Hello, everyone. We are back again today with a new guest with us. So today we have with us Dr. Vishwas Gowda. Dr. Vishwas is his specialty is operative dentistry and endodontics with a very special emphasis on microscopic endodontics. He's the one of the very few endodontics in the country who probably does it with microscopes. So that's a very big specialty that he can boast of. Dr. Vishwas has been assistant professor with VS Dental College. Apart from that, he runs his own dental clinic in Bangalore by the name Summit Dental Clinic. And he goes consulting to various clinics all over the city. So please give a warm welcome to Dr. Vishwas Gowda. Vishwas?
Good afternoon, Dr. Amol. First of all, thanks for having me here. It's real pleasure being here. I hope you are having a good day so far.
Yes. So, Vishwas, today we are going to address a few basic questions on the topic of root canal treatment, the dreaded root canal treatment as per the patients, So whenever you talk about root canals, patients, the first reaction is as if we are going to take out some major body organ out of their body or something, So you can see the color running off their face or something. So let's try to address the myths about root canal treatment for a few of our patients. So are you ready for the first question for the day?
Yes, Dr. Amol.
All right. So the first, one of the most basic questions that you probably even you get to encounter with your patients in everyday practice. Why exactly is a root canal treatment required, and why and when? And if you can explain a little bit in very simple language for our patients about this particular treatment option.
So, to begin with, very basic things. Your tooth has three main parts. One is the enamel, the dentin, and the pulp. The pulp is the area where your blood vessels and nerve fibers, to put it in layman terms, are reside.
Right.
So whenever there's the patient doesn't feel anything except for discoloration, which you can see. But as soon as it reaches the dentin, that's when the sensitivity starts. But most of us tend to ignore that, and then it reaches the pulp or the area where it's the nerves are. That's when the pain begins. Now the root canal is a simple procedure where you clean or remove the pulp. That's the basic gist of a root canal. Now, why is a root canal needed? So basically, whenever the pulp or the nerve fibers are infected or inflamed, and this can happen due to various reasons like deep dental decay or repeated dental procedures also can cause the same. Sometimes fractures of the tooth or a crack in the tooth, any trauma or an injury. So, or sometimes what can happen is even if there is some infection that comes, that can travel up to the tooth and that can inflame the pulp. So these are some of the few conditions why a root canal might actually be required.
Right. Can you add a little bit about sometimes a deliberate root canal treatment is required in certain conditions, in certain cases, especially when you are doing crown preparation, which is going to go very close to the nerve, to the pulp, as we say. So even that could be one of the reasons. Am I right about that?
Yes. So this is something called as intensive root canal, which is done.
Right.
So many times when there is a wear in the tooth, or you have to place a crown on the top of the tooth, you prepare the tooth, and since you have to reduce a certain amount of tooth structure to place a cap on top of the tooth, this preparation might be very close to the nerve or the pulp. And in these cases, they might be, and that is probably one of the reasons why you do a root canal, anticipating some pain or discomfort after placing the cap. And this procedure is called as the intensive root canal. So this is also pretty common, especially when you are replacing the teeth. You do a bridge. Bridge is where you take support of one tooth in front, one tooth behind, and you replace one tooth in between with 3 teeth. So in these cases, you have to put the teeth in front and the tooth in front and the tooth behind. So these are some of the cases where, or in case of extreme wear, where you have to give a cap, or in sometimes even in full mouth rehabilitation cases, you do this intestinal root canal.
Right. Wonderful. I think that explanation is going to help our patients a lot. So, moving on to the next question, what are the signs and symptoms that you see in the patient's tooth, which necessitate a root canal treatment? How would you say that, okay, this tooth requires a root canal, this doesn't require? So what's your say on that particular front?
So one of the most common reasons why patients do come to us is pain. So pain is one of the most symptoms which the patient would want to seek some professional help. So pain is one of the major causes. Other than that, sensitivity to hot and cold, and especially even when you remove the stimulus. That means, for example, there might be times when you have an ice cream or having a hot cup of tea, and there might be sensitivity. So this again can be times. Sometimes the sensitivity lasts even after you gulp down the tea or you swallow the ice cream. Okay, so those are the cases wherein you actually require root canal. If at all the sensitivity lasts only till the time ice cream is in your mouth, then probably you can get away with a filling also or a restoration. But this is something to understand. Other than that, discoloration of the tooth. This is most commonly in cases of trauma. There might be an accident. A patient would have fallen on his face, or probably something might have hit his front tooth. Eventually, that tooth would have discolored, and that also might be one of the reasons why root canals are done. And that's a sign. So discoloration is a sign. First discharge from the tooth or from the gums around. That's one of the signs when you might actually require a root canal. Pain while eating and biting. So pain can be again two types. One is spontaneous. The other one is when you are involved in something like eating and biting. So pain in eating and biting, that might be also due to some crack or a fracture in the tooth, which might eventually require a root canal. So these are some of the signs or symptoms that you see when you might, if at all you have one of these things, then probably you might think that, yeah, maybe I require a root canal.
Okay, so since we spoke a little bit about pain, let's elaborate a little bit more on that particular word, which is the primary concern of any patient. How much, or is there any pain associated with the whole root canal treatment per se? Before treatment, during treatment, definitely before treatment, that's the whole reason why patients come to you. But during the treatment and after the treatment, what kind of and how, what's the amount of pain that a person can expect?
So if you actually look at how much dentistry has evolved over a period of time, especially in the last 10-15 years, the amount of technology what we use in today's practice is unimaginable probably about 20 years back. So whenever a patient comes to you, the first thing you see the patient, you diagnose, you say that this tooth requires a root canal. The first thing the patient actually thinks of is some history wherein he or she had got a root canal done, or one of their friends or family had got a root canal done, and they associate it to pain. That's the most common thing. But today's treatment is completely different, right? From anesthesia to the technology what we use today. In fact, the anesthesia, not only the syringe, you have so many different ways of anesthetizing. Even the solution what you use, you have articaine, when you know, which is long acting and also much better. And the technology, the things, the microscope, what I use very much, and also some of us also are slowly starting using the microscope for root canal, and also the rotary instruments, wherein it's pretty quick, and you know that you can actually predict what's going to happen. So the whole treatment has become more predictable.
Exactly.
Once the patient is anesthetized and the anesthesia kicks in, or if it's working well, there should be absolutely no pain. Post-operatively, whatever, this is a minor surgical procedure, so you can expect some pain or discomfort for a day, for which the painkillers are prescribed, and that should take care.
Absolutely.
But when you see with the root canals these days, you can actually confidently say it's absolutely painless. And post-operatively also, it doesn't interfere with any of your daily activities. Next day morning, you can probably get up and go to the gym or run and get along with your life so easily. So that's one of the technology is easy, and the fact that we know more about what works and what doesn't work, even that has made it easy.
Right. We even have the option of conscious sedation nowadays, which is pretty widely used. So that's an added, advantage to some extremely nervous and apprehensive patients. Yeah. Okay. Now let's move on to the actual procedure. I know it's a long procedure, but if you can briefly run through the various steps about how a root canal treatment is performed, so our patients get a fair enough idea as to what they can expect, if at all he or she needs to go through a root canal procedure in the future. So just in brief, I know, let's not get into the dental jargon too much, in a very simple language, if you can, please.
So, like how I mentioned again, the tooth is divided into two parts. One is the crown portion, which you see in the outside, and the other is the root portion, which is inside your bone and the gums. The root canal, as such, the nerve fibers and the blood vessels are present partly in the crown and mostly in the roots. So the whole idea of a root canal is to gain access to these roots, clean them, remove the infected pulp or the nerve fibers, whatever you call, clean them, and then enlarge them. Why do we need to enlarge them? Is to make sure some of the irrigants get there, again clean properly, and then fill it with a material. So the material should be is mostly whatever material we use right now are biocompatible. It's completely safe. So you fill the roots and then pack the crown or the top portion of your tooth with the normal filling material, and then give a cap on top of it, so that the tooth lasts longer. Some of the cavities are stupid. You have to enforce the tooth or the crown with a cap. So this is the procedure of root canal endodontist. It's pretty simple, fast, and also it's predictable.
Right. Yes. That summarizes root canal treatment very well. Thank you very much. Let's go to the last question. You would have heard in your practice as well, that whenever you have suggested a root canal treatment to a patient, they would have said, "Doc, why don't we just knock off the tooth, just remove it, So, and then we have to explain the pros of going for a root canal treatment as compared to extracting a tooth, because after extraction, your tooth is gone permanently. That means the only other option is to replace it with an implant, supported crown or something. So I want to hear from you, what is an advantage of saving a tooth by doing a root canal treatment over extraction? So if you can give some insight of yours.
Yes, so the way I look at these things is slightly different. What I tell my patients, most of my patients, is we are trying to delay something that's inevitable. So, for example, you have a patient who is around 32, 33 years old. She comes with a pain, and you advise the root canal. Now, the first question the patient asks is, what guarantee or how long it's going to last? Now, who knows how long it's going to last? But we have seen so many well-done root canals what won't make it 20 years or 25 years. But what we are trying to do is considering that she is just 33 years, let's imagine this root canal lasts for another 15 years. So while she's around 48, 50, even if it fails, you can give it another chance to a re-root canal, which might last for another 10 years.
So exactly.
At the age of 60, even if she has to lose a tooth, that will be a good time to place an implant, rather than placing an implant at the age of 33, 34. So this is one of the biggest benefit of root canal. You keep your tooth, so you keep only what is yours and not what is not yours, and nothing can replace your natural tooth. So that's the biggest benefit. Other than that, it also saves and it restores and saves your natural tooth. It relieves pain. It also stops the spread of the infection to adjacent teeth or the neighboring tissues or bones or bone around the infected tooth. It also maintains the proper bite and alignment. You'll be able to chew better. So, like how most of the time when you take the tooth out and if you don't replace it, the teeth around it tend to drift into the empty space. So these things can be prevented by when you actually do a root canal. Like how I said, the biggest of them all is you save your natural tooth, and nothing can replace your natural. That's the biggest advantage.
Right. Wonderful. So the bottom line here is to save a natural tooth as far as possible. Even though we have all possible technologies and means nowadays with, for example, beautiful zirconia crowns and bridges, and even implant supported crowns and bridges, but a natural tooth is a natural tooth. So as far as possible with a root canal treatment, you save your tooth, a natural tooth, the God-given natural tooth. Yeah.
Correct. I jokingly tell this to patients that if you can't keep your natural tooth, what God has given for about 30-35 years, I am after all a man. What can I do?
Right. It was wonderful chatting with you, Vishwas. So thank you very much. I think this session today is going to help our patients immensely. We'll do one more session with you probably in the future, and next time we'll talk more in detail about microscopic endodontics, because that is one field which many of our patients don't really know much about. What exactly is microendodontics? How different it is from the conventional endodontics, which is conventional root canal treatment. How different is micro endodontics? So we'll come out with another session on that particular topic very soon. Thank you so much. Thank you for your time. It was our pleasure having you here today. You have a nice day ahead. Bye-bye.
Thank you. Thank you, Doctor. Thanks for having me here, and looking forward for the next session. Thanks a lot.
Pleasure. We'll meet soon. Thank you.